Hello, welcome to the Medical Imaging Lecture Series. Today, I am going to talk about what medical imaging is, how medical imaging is classified, what are the different modalities of medical imaging, and overview of medical imaging system. Medical imaging is the technique and process of creating visual representation of internal organs to help doctors diagnose, monitor, and treat diseases. Based on the purpose, medical imaging techniques are classified as anatomical imaging, functional imaging, and fusion imaging techniques. Anatomical imaging techniques give anatomical details of internal organs. Examples of anatomical imaging are X-ray, CT scan, ultrasound, etc. Functional imaging techniques give functional information of internal organs. Examples are PET scan, SPECT scan, etc. Fusion imaging is combination of anatomical and functional imaging to create anatomical as well as functional representation of an internal organ. Example of fusion imaging is CT plus PET scan. Let us move towards different imaging modalities. Different imaging modalities are PET, X-ray, computed tomography, that is CT scan, ultrasound, that is sonography, magnetic resonance imaging, that is MRI, nuclear medical imaging, thermal imaging, and optical imaging. There are two modalities of nuclear medical imaging, which are positron emission tomography, or PET scan, and single photon emission computed tomography, or SPECT scan. X-ray and CT scan use the X-rays for imaging. Ultrasound is based on high-frequency sound, and MRI is based on nuclear magnetic resonance principle. Nuclear medical imaging use nuclear active substance with biodegradable material to get functional details. Thermal imaging is based on thermal emission of organs, and optical imaging use optical principle. We are going to throw more light on physics of each imaging modalities in detail in the coming lectures. Now let us see the overview of medical imaging system. Medical imaging system can be broadly divided into three parts that are image acquisition, image processing, and diagnosis. Based on the requirement and application, image is acquired, and then different image processing techniques are applied on it to make it better so that doctor can diagnose or interpret it and come to the conclusion. To know the complete medical imaging system, it is equally important to know the image processing techniques and image analysis. That's it for today. See you in the next lecture. Thank you.